Hello everyone. My name is Simran Chaudhary and I warmly welcome you all for joining us today for this special panel discussion on World Health Day 2025 on behalf of Voice of Healthcare. So each year on April 7th, World Health Day offers us a moment to reflect, recalibrate, and recommit to building healthier communities. This year, the World Health Organization has launched a powerful year long campaign titled Healthy Beginnings, Hopeful Futures, calling for a renewed focus on maternal and newborn health as the foundation of thriving society. And despite the progresses we have made, far too many women and newborn around the world continue to face preventable risk during pregnancy, childbirth, and the critical early days of life. So now it is time we moved from awareness to action, ensuring that every mother and every child not only survive but truly thrives. And to help us explore this deeply significant theme, healthy beginnings, hopeful future, transforming maternal and neonatal outcomes, we are honored to be joined by two stalwarts of Indian healthcare. Now, I would like to introduce you to all Dr. Suvarna Khadilkar, President of Mumbai Obstetrics and Gynecological Society. She is a passionate advocate for maternal health and women's well-being. Welcome to our show, ma'am. It's a pleasure to have you. Dr. Vasant Khalatkar, National President of the Indian Academy of Pediatrics, whose work continues to impact newborn care and child health at national level. Welcome to our show, sir. Pleasure having you. So, together with their perspectives spanning both maternal and pediatric care, promise a truly holistic dialogue. So, without any delay, let's dive right into this important conversation. I would like to start with Dr. Suvarna. Ma'am, to begin with you, this campaign calls for an urgent push to end preventable maternal deaths. From your experiences, what are the most pressing issues still affecting maternal health outcomes in India?
Thank you, Simran, for at the outset for inviting me here. That this topic is so close to my heart, and India still grapples with high mortality rate in certain areas, and there are certain states who have really conquered the maternal mortality rates, and they have brought the rates quite low. And our SDG goals say that the maternal mortality rates should be brought down to 70, but I say, why not aim for zero maternal mortality? We must all fight against this and bring down to zero so that we can save each and every life of a pregnant woman. And basically, some areas there are a lot of issues like inadequate access to prenatal care, particularly rural areas, where we don't have access to expert care. And then we have the insufficient skilled birth attendants, and emergency obstetric care is not available in these areas. There are so many, you take whichever area, you take urban, you take rural, everywhere one big problem which is pressing is anemia. Almost 50% of women are anemic, and when they get pregnant while they are anemic, they face a lot of complications. And I will say the three biggest enemies are the anemia, pregnancy induced hypertension, and postpartum hemorrhage, infection, and diabetes. So these are 3 4 conditions which are still going around, and we have to yet conquer them, yet control them. But there are, lot of efforts being done, but still there is socio-economic disparity happening. There are some areas where there are no money to eat. They can't feed their women at home, and women is the most neglected community, I must say. And there are still households where the women are given the food even though they are pregnant, not pregnant, young girl, adolescent, they are given leftover food and poor nutritional content. So that is how they become anemic, and that is how they face all these problems. Illiteracy was also a big problem earlier. Now it is getting better, and lot of gender inequality. As I said, the women are the neglected community, and we must all create awareness in this regard. Thank you so much, Simran.
Thank you so much, ma'am, for shedding light on such important topics. And, explaining all those factors, how it is affecting the maternal and newborn health. As I think there are many aspects which are overlooked, like you mentioned, and the inequality is definitely there. And the women's is the most neglected community in the society. And because of the literacy, we have somewhere reached to a point where we have started, putting a little bit of focus on their health also. But it's a long journey we have to go. Thank you so much for highlighting all those things, ma'am. Dr. Vasant, when it comes to newborn health, the first 28 days are the most vulnerable. So, what are the some recurring challenges you see in neonatal care across different healthcare settings?
Yeah, thank you, Simran. It's a valid question, and it's a really good question because I'm answerable as a patient for this. Most of my questions were answered by Dr. Suvarna because see, this is when the seeds are sown, what they're getting. That all depends, and we are literally dependent on these obstetricians. Really, that's why nowadays one of the most upcoming branch is coming in, that is the perinatal. So we are having a very good program, that is SAT. That's a Oxy and IAP. You might be knowing that about a vaccine, HPV vaccine and everything. That's okay. But this is the basic thing. Since last 3 months, we are doing working on this. We have developed a very good module on perinatology. Few lectures by obstetrician, few lectures by pediatricians, and that where we do it. That how to now coming to neonatal mortality. Neonatal mortality is still problem in our country. That's first. Dr. Suvarna has already told about the nutrition, hygiene, neglecting mother. That was really about infection. They don't know our education status. Everything it matters. Definitely, education status is a very and our rituals, very common rituals. नहीं ANC visit नहीं करना है, घर में delivery करना है. There are so many things. That's why this hospital delivery concept came in our mind, and government is doing lot of work. That's why it's that neonatal mortality rate was 39. Now it per lakh. Now it comes to 20. 20. And as Swarna madam said, we are really trying hard along with WHO, UNICEF. Everybody is having, or even our government, health government is that we want to make it zero prematurity. And I like the statement by your president, Dr. Nandita Anay, sir, Suniti Tandavkar, na? Your
Sunita Tandurkar, yes.
he said कि we want zero birth. Madam, हाथ से हाथ मिलाया जाए, like that's you are really getting doing the great soil. And prematurity is possible. First and foremost thing is the prematurity, which we can prevent if we can do this. See, we are doing the best of that. When the child is mature, we have survival nowadays 300, 400 gram baby. But why one should spend? It's a one tenth of the money spent on the mother, then you can get a very good baby and proper nurturing care. That obstetricians are doing really great job. Sonography also help us a lot nowadays. Too many things. So that's the good one thing. Secondly, the most common is the infection. Still, it's going on. No, not proper hygiene, not proper delivery. Still, guys are doing, but they are not well trained how to go for delivery, how to have a hygienic delivery. See, we have a survey infection rate in the private nursing care and as compared to that to be in a city, that to be in a rural area, and that to be in a government medical college. We have seen the toppers goes to rural area, from where we get so many sick child with a sepsis. Second from government, and third from private. Private comparatively it's less because they're taking utmost care. But nowadays I have seen the rate is also decreasing in medical college because so many things are. Only issue is still in rural area because see, I don't blame government, or I don't blame the obstetrician, that there is a defect in our community. So nowadays, what is the need? What we are doing? We are directly reaching to community. We don't want. We are teaching our pediatrician, and we don't directly go to community. That is the need of the hour. Now, and there's feeding problems, so many feeding problems because our customs, 1 घंटा दूध नहीं लेना, 6 घंटा दूध नहीं लेना, बाद में दूध पिलाना, माँ को दूध पिलाया तो इश्यू होता है, फिर सेकंड थिंग माँ को खाना नहीं खिलाना, फिर से हम आई कैन अंडरस्टैंड द कसरत ऑफ ऑल दिस ऑब्स्टेट्रिशियन, कितना उनको हम तो बोल के चले जाते हैं अरे यार आधे घंटे में दूध पिलाओ ये बच्चे को, पर what they are facing really, but this is a need of the hour. Early breeding, early within 1 hour, that's a golden period we say. That is a very important. And some congenital diseases. Definitely, these are congenital diseases. Wherever they are, they do still communities that they don't go for a doctor, they don't go for any KNC checkup, and they don't go for a, as a detection of congenital disease. So there are mostly in those cases, and once it is 3 months, 4 months, again our PCP and DT Act is there. So these people are also helpless. So these are the few point I want to say. And definitely for 28 hours, 28 days, secondary pneumonia, diarrhea, these are the common problems. But these are all secondary. I'm telling you prematurity, infection, feeding problem, and congenital. Okay.
Can I
Thank
just
you,
add
Dr.
a little bit here, Simran?
Yes,
The
yes,
thing is that preterm labor and the deaths due to prematurity, I think it is a joint effort of obstetricians and neonatologists who will, improvise the rates, because, in spite of best of the efforts, the baby may deliver prematurely, and it is the best of the efforts that neonatologists, they take, and they save the lives of preterm babies. So as Dr. Khalatkar said, I think they are doing best to take care of very low birth weights and preterm babies, and that is where the neonatal mortality is higher. And in our country, maternal mortality, about say 10 years ago, it was very high, 130 per 100,000, but now we have come down to 97, and our SDG goal is 70. So I think we are, as a whole, the country has done a commendable job. But I had visited a few interior places, and there I found the maternal mortality rate is still higher than our 10-year overall maternal mortality rate. So lot of focus and activities and awareness has to be there in certain areas where the mortality is higher.
definitely, ma'am. And thank you so much for sharing those facts with us. But as we're moving forward to our conversation, my question is to Dr. Suvarna. Maternal health is often, seen only in the context of childbirth. But how we can shift the focus towards the long-term well-being, both physical and mental health of women post-delivery? Because now we are seeing a lot of cases of postpartum depression and nutritional care of mother even after the delivery. Because if a mother is healthy, a baby is, they can deliver the better nutrition to the baby. So how we can shift our focus there also?
You are absolutely right, because what happens is once the delivery takes place, the entire focus goes on the baby, and the mother is neglected again. So the best lactational practices have to be taught to the mother, so that the baby gets good nutrition. And the peripartum mental health is a most pressing issue that today's mothers are facing, because of lot of issues, poor nutrition, family history, lot of stress that is going on, and they have gone through pain of labor, so they have these kind of issues which they face, and you may find that they are having lot of mental issues, depression, and there are certain highly pathological depression can even these girls or women who deliver can go to commit suicide. So we really have to take care of these high risk women. All women don't have, but there are certain risk factors which are defined, which you can go ahead and see if there is a tendency, if there is a family history, a lot of stress has been there, has been facing a lot of issues in the family, then these are the people. And especially if the the fetus, suppose there are a lot of things when mother cannot lactate well, she cannot feed the baby well, and then she again gets a lot of depression, that she is not able to sustain baby's nutrition. So all this counseling is most important, and you have to provide comprehensive counseling on both physical and mental health, and you have to integrate the postpartum care into primary health care routinely, and not just wait till she has some issues. And most of them, half the women population is anemic, and during childbirth they also lose a lot of blood, and if they lose little bit blood also, it really reflects on their health. So proper and postpartum as well as antenatal, whatever nutritional supplement she was taking, she has to continue them in postpartum care. Vitamin B12, iron, folic acid, and calcium, she has to continue throughout the postpartum care, and they have to stress on it. I've seen so many women who come and they say, no, doctor had given only 15 days prescription and we have stopped it, and they go back to their previous anemia level, and they are feeding the child, so they further have nutritional deficiencies. So you have to do all this after them. Foster community support networks, enable them to connect with peers, and access resources. With There are WhatsApp groups, nowadays women have, they discuss all these issues after the delivery, whether what kind of advice their doctors are giving, they exchange their thoughts. So I think the community as a whole is improving. They are very much aware that these issues they may face, and they are well prepared. You have to use the social media for increasing their awareness, and we have to have the policy change at the government level also, because we have only just say 4 to 5 months of maternity leave, and the fathers also paternity leave is very short, I suppose. And it's a nowadays we have no joint families, so there are many families who are only the mother and father of the child are looking after. And if she is the single mother, she will face a lot of challenges managing the baby, managing the house, cooking, all that. So all this must be really taken into consideration, and we have to have an extended paid maternity leave if she's a working woman. And there are a lot of problems of lactation, consultants are there, so a lot of problems of lactation can be solved. We can have the express breast milk saved for the baby in case she has to go to work. So a lot of things can be done in postpartum period to help the mothers gain their health back. And the postpartum exercises, they are very important, otherwise they will lead to long term problems like prolapse and urinary incontinence and things like that. So I think postpartum care is very very important, and you have to really stress upon in all clinics and antenatal as well as postnatal clinics. Thank you.
Definitely, ma'am. And you pointed out all the right factors and how we can add in to our, the daily routines, and how doctors can help, and how we can, actually work on these steps so that we eliminate all those problems which we are discussing right now. So, Dr. Vasant, as a pediatrician, sorry, as a pediatrician, what role can doctors play in educating new parents, not just about the child but also about the mother's health post birth?
Yeah, very good question. Very important is that I told you about what Indian Academy of Pediatrics is doing. I had talked to you about the nutrition, prematurity, and one of the major cause of death we might be knowing that is asphyxia of neonatal. It means baby not cried well, or not cried, or cried in so it's not proper. So what is the need? There is a need of resuscitation, and you know that about 1% of death is due to asphyxia neonatal. So if study shows that if we train our doctor, our health worker, our staff, then that can reduce to 0.1%. There are 1% baby, those who don't cry, but out of that 99% child can get survive. So what is the training we are doing? That a neonatal resuscitation program, that Navjat Shishu Suraksha Abhiyan, that is in Maharashtra, but it's a NRP, and we are trained lot of, till now, since last 4 years, we have trained 2,80,000, including students, nurses, and health workers. We are trained, and we are getting the advantage. Suvarna madam must be agreeing with me that because of training there is a lot of difference. Well, not to say it's, I'm openly saying most so many pediatricians were not knowing how to go for this NRPT, what is the neonatal resuscitation program, when to resuscitate, when to intubate, when to go back and master. That is a huge program IIP is running. Definitely, this nowadays is going on. Garbha Sanskar, what these obstetricians they are doing, and I know after delivery baby is there, so we have to train mother, but before that there is a need of a time that obstetrician and pediatrician should come together, counsel the mother what is the care child is needed, about the breastfeeding, definitely that early hour breastfeeding we should have. And in those classes, there is a need of how to give the hygiene. Hygiene is, you know, that in our whenever there is a birth, hundreds of people visiting the baby. That is very bad. That is a, and they have to suffer. We have to treat the child about a sepsis and definitely immunization. Thursday, Europolio, BCG, and hepatitis is mandatory. You can BCG you can postpone for 3 4 days, but hepatitis is very much mandatory. That first dose should be given at birth. Early feeding, immunization, and breastfeeding early, and that our ECD, that early childhood development, that should be known to every mother. Every mother, she should be trained. Because see, grandma, grandpapa, or father is not. Most of the time, mother is main key person who is responsible for that. So mother should be well trained. And now coming to preterm care. Preterm care definitely we have improved because of the ANC care, but still it's there. Our preterm care should reach to periphery. That is very important because in city, government colleges, private colleges, medical colleges are there and they are getting a get good care. But what about the periphery? Whenever any premature birth at periphery, from suppose I am taking example of Nagpur, it's a 50 kilometer away, premature baby deliver. Nobody knows how to transfer. That is very important. Suppose if the transfer is good, no issue. That is the thing. Medical officers, the health worker, and while traveling, there is a death. That's a very pitiable condition. We really we should. This is the thing. And Madam talked about the maternal care, paternal care. I also endorse that. You might not be knowing 30 years before IIP tried lot, and that maternity leave, which was a 3 month only, that had done with 6 months. And this year I'm trying for paternal leave more than at least 1 month. At least 1 month. That's our government. I'm going to government. We are IAPN. We are trying lot that at least there should be father. I know about a nuclear family. There is no one is there. Abhi mother father say busy, grandmother grandfather busy hote hai. That's the issue. That's why there is a need of a paternal income. And in private companies, they are giving a 3 month, 6 month paid leave. But what about the government? So at least maternal leave we are trying for 9 months and paternal leave at least for 1 month. These are the issue. So basically, I will say there is a need of education at large. That is community. Where to reach the community. It's not the only doctors' domain, but there are so many social workers. There are health workers. They should reach the community, and they are the best person. So I will tell मदर से ग्रैंडमदर ग्रैंडफादर के क्लासेस लिए जाए और उनको ट्रेन किया जाए. That's my thing.
Very true.
Yeah.
Very,
Uh,
very well said. So I think we have all the education there in our houses only. Grandmothers, grandfather have raised their kids very well, and now they're seeing the next generation. So I think that should pass on. And the way Suvarna ma'am also discussed about the maternal, paternal leave, same did you. So I think that's a joint efforts which we are putting, and slowly and gradually we will witness those changes, and that will help us in taking care of mother and newborn baby in a better way. So thank you so much for all those efforts the organizations and the leaders are putting on in this sector. Dr. Suvarna, that access to safe maternal care is still a challenge in rural and underserved areas. So, what policies, changes, or grassroots strategies would you recommend to bridge this gap?
Before that, I just want to say that as a obstetric gynec societies at Mumbai level as well as at national level, that is a FOXY, we are having numerous programs to create awareness, and many of our programs are in collaboration with Indian Association of Pediatrics. So where we have a joint awareness programs, then teaching programs, the obstetricians are trained, because in case your neonatologist doesn't come, you should be trained how to resuscitate the child in case of emergency. So we have all these scientific conferences and CMEs that we organize to create awareness amongst our doctors, right, pediatricians as well as obstetricians, and we have to have a lot of collaborative care plans with them and address needs of each family. And what we used to do was, after the mother delivers, she is called for immunization, so they definitely come for the baby's immunization. One very important point I didn't mention earlier was the contraception between two pregnancies. If they do not use proper contraceptive methods, then they will have unwanted pregnancy, and again that poses a risk to the lives, because they don't go to the right doctor, they go to some untrained person, they get the abortion done, or they take medical pills on their own, and then they risk their lives. So we have to advise them proper contraception, and that is the time, 6 weeks later, when they come for the first immunization to the with the pediatricians, we catch hold of them, we have a joint clinic with them, postpartum care unit, and we advise them to use some kind of contraception, can be the copper-T, or intrauterine contraceptive device, or any other contraceptive, progesterone only pills or injections. We have many big basket of contraception that is available to prevent the next pregnancy coming up very close to the first one, so that it will help build her iron store, and the next pregnancy again she will be healthy and the baby will be healthy. Another point I just wanted to say, the keeping with the WHO theme of healthy future. So it is us obstetricians duty to give nutrition to the mother and prevent all the kind of diseases during pregnancy, because it is often said that the adult diseases begin in utero. So it is
Yes.
the fetal origin of adult diseases. So we have a very good responsibility to prevent the adult diseases by doing taking good antenatal care, and all these all these efforts should go in preventing these conditions like diabetes in pregnancy, pregnancy induced hypertension, and all this can be prevented, and we will have a healthy future if we do like this. So that is what I would like to give a message for the healthy future generation. We have to have these kind of solid nutritional plan and antenatal clinics which take care of high risk pregnancy also. And we have at FOXY level, we have high risk pregnancy training program. We have lot of big projects we have undertaken, where we are reaching out to the under served areas, like poor areas, rural countries where the mortality is high, and the nursing homes where private sector they are not given proper training. And so we go and reach out to them, and we train them for the proper setup of their hospital. We train their nursing staff, we train the doctors as to how to handle emergencies. So I think lot of that is showing effect. And as I already said, that earlier the hospital deliveries were only 40%, Simran.
Yes.
Yeah, and those days we used to have very high mortality and what is called as near miss conditions, like they if not, they don't die, but they are suffering from serious hemorrhage, serious hypertension, eclampsia, so they have fits during the pregnancy. So all these are near miss conditions, which also nowadays we should focus, so that we have managed to reduce the mortality, but what about the morbidity and high risk conditions? So Foxy and MOGS both are doing a lot of efforts in that direction. And we have now hospital delivery rate has gone out to almost 88.5%. So that this is one of the major factor why we have reduced the mortality. So it is a message to all that please deliver your mothers in a hospital, and do not dare to keep them at home and deliver. There are a lot of myths associated with it. No, if you go to a doctor you will end up in a cesarean section. Don't go there. They will unnecessarily give you heavy expensive medication, but it is for the good of the women, it is for the health of the woman. So I think that message also has to go down, and lot of policies have to change at government level. They have already undertaken anemia hatao. We want no anemia movement is happening. So at the government level, and we all are complying with that, and we are having big drive to prevent anemia. Half our battle will be won if our anemia, because it is years that we are seeing that women are anemic, and almost 50% of them are anemic. So we have to do our best to, right from childhood, the nourishment, iron supplements has to start, so that when they get pregnant they are having good hemoglobin, and that will prevent half the mortalities, and that will prevent half the conditions that they suffer in pregnancy.
Definitely, ma'am, and we really appreciate the groundwork Mogs and Foxy is doing, and we know that at every level of the primary health sector or even the hospitals and every other, how the gynecologists, obstetrics are working to eliminate anemia from the mother so that it does not transfer to baby, and we can have a healthy community, future healthy community. So thank you so much for all those hard works and every step which associations, governments, and everyone is taking to eliminate this. Lastly, my question to Dr. Vasant is, sir, as a leader of National Medical Association, what would be your one urgent call to action on this World Health Day for government, health professionals, and the public?
My important step is that breastfeeding to be mandatory. Maternal leave should be more than 9 months. That is at least 9 months. First thing. We always believe in collaboration. So we are doing along with the government neonatal registration program. We should have a great grand expansion. Grand expansion should be there definitely. And preterm care, for preterm care we are training our doctors and health workers. This year we had a one program, that is the round table discussion. We should our any discussion in round table, and that we make free for a common public, our doctors, our general practitioner, health workers, like that. That's one of the two topics with the early childhood development and secondary. That's a very nicely came up round table discussion. I can send you the link of those program definitely. And this year we have started one good program, that is the IAP ki baat community ke saath. Initial 1 month we tried with the news media, digital media like WhatsApp, Facebook, and everything. We were discussing different topics, and that to be through this all media we wanted to reach the community. But we saw that there is not much impact, because आजकल पेपर पढ़ते नहीं लोग, व्हाट्सएप देखते नहीं, फेसबुक पे भी जाते नहीं, और फेसबुक एक दिन नहीं देखा तो दूसरे दिन मिस हो जाता है. Then we have done a novel program this year on two topics. That's one is on substance abuse, and second is on obesity. We have made a movie with the Bollywood actors. One is the Disha, that is for substance abuse and children, and second is the obesity. That is how to fight against obesity. These two movies are 30 minutes movie. It's available on YouTube, and we have seen the great impact. That's a see the substance abuse movie got the international film festival award. So my request to government is that now the media is very powerful. So government should go with through the media with the help of a obstetrician and pediatrician. I never said, because I know without obstetrician, without Foxy, IAP can't do it. It's a joint and joint collaboration. Like we are always saying government that we need you. Like that, we need to go. And really, we are fortunate. My wife was sitting, she's gynecologist, Pragati Khalatkar. She is there. She was there, just there. So definitely, we are very much. Whenever there is a maternal and child health care, that's always the best. Nowadays, people prefer that they want a maternal and child health care unit. They don't want a separate gynae, separate pediatric. That shows you how much the importance of Oxley and pediatrics unit. Along with that, we definitely need a and UNICEF also. UNICEF now they want a zero mortality. ICMR also want zero mortality. Everybody want. Now it's a time to act. बट वी नीड इमेंस हेल्प ऑफ गवर्नमेंट. हमारे यहाँ लोग काम करें, फॉक्सी हो या आईपी हो, काम करने के लिए लोग तैयार हैं. व्हाट्स एवर वी आर टेलिंग गवर्नमेंट दैट शुड गेट इम्प्लीमेंट. नहीं आज 100% काम होगा तो एटलीस्ट 70% तो इम्प्रूवमेंट डेफिनेटली होगा. तो दैट्स अ वेरी इंपॉर्टेंट. So my request is that the government should work hand in hand with that's why IAP is this way. Along with this paternal leave, we are trying for separate child health ministry and separate maternal, like because this is ministry is the woman and child health. वुमन के पास वुमन के बारे में लेने जाओ तो बोलते कि हमारा पैसा पूरा पीडियाट्रिक में ट्रांसफर होगा. पीडियाट्रिशियन जाते हैं तो वो बोलते कि नहीं मैटरनल केयर के लिए जाएगा. That's why we are trying at high level that there should be separate child health ministry from government. They should be separated.
Thank you
Thank
so
you.
much, Dr. Vasant, for the efforts you and IAP is putting in this direction so that we can have a better environment and all those better treatment options and all everything for the neonatal and the mother. Dr. Suvarna, last message from you for a public action point which we can work on this World Health Day in this theme.
I think the World Health Organization has declared a fantastic theme, healthy beginnings, hopeful future. And for that, I think as obstetrician, as Foxy leadership and in Mumbai Obstetric Gynec Society, I recommend that we have we have to do women's empowerment. Women have to know that they are supposed to get, and they deserve good nutrition, they deserve health. So they should not say that no, I will not take proper diet. That is going to affect not only this their generation, but is also going to affect the next generation. And then it is the next generation is going to develop a lot of diseases when they become adults. So that is what I feel that women should feel. And then we find so many of times that the women report to hospitals only at the night time after their husbands have come back, and by then it might have been late. So
Yeah.
don't do that. And even the families, the husbands, the mother-in-laws should take a message that you have to look after the the daughters and daughter-in-laws who are pregnant, and they are the priority and not as the last choice, that when the husband comes back from the work they should take the lead and bring the pregnant lady to the hospital if she requires. So that is what my message to all, that please eat healthy and lead a healthy life for the hopeful future.
Thank you so much, ma'am. That sums up our session. That sums up
I
why.
also echo, I also echo Suvarna's view that that's very important. That's why I'm telling you that important is to teach the community, grandmother, grandfather, and all relative what care should be. Because mother खुद होके कभी नहीं बोलती. It's every time happen. We go to our home. We wanted to go to home by 9:30 p.m. from OPD and 9:30 में तुम्हारे दरवाजे के सामने क्यों लेट आए तो अजी यही तो घर पे नहीं आए, इनके सिवा क्या कर सकते थे हम, इनके सिवा. दैट्स रिडिकुलस. इनके सिवा क्या कर सकते हैं. मैं उनको हरदम बोलता कि what is happening, but this is not a task of a single person. It's a mental health or our mental status should be changed एकदम. वो जब तक चेंज नहीं होगा, need that women should get that earnest that complete जो ये मिलना चाहिए, honor मिलना चाहिए, they should get it. That is very important. Then only we are going to survive, because we know mother is the best person who can nurture child at any level. Thank you.
Very rightly said, sir. And thank you so much, Dr. Suvarna and Dr. Vasant, for sharing your insights, views, experiences, and how we can collaborate together for a healthy beginning and hopeful future, which is the theme of World Health Day by WHO. So thank you so much for coming to a platform, sharing your views, educating our public, because this is a very important topic to raise awareness and educate our public for a better future. Thanks a lot.
Thank you. Thank you so much.
Bye-bye. Thank you, Suvarna madam.
Thank you, Dr.
Yeah,
Vasant.
Pragati was remembering you. She came, that's why she came here. Right. Thank you.